Hi, I'm Dr. Raghu Athre. I'm a double board certified facial plastic surgeon here in Houston, Texas. Welcome to my Facelift webinar where we talk about the 4D facelift. What is it? Who's a good candidate? And what is a patient going to feel through their entire journey through this process? So one of the things that we need to really understand is, how does aging really happen? So if you ever take a look at a young baby or a young person, you'll notice that the vast majority of the volume is way up high. So you've got the big cherubic cheeks, sharp definition along the jawline, sharp definition along the neckline. And if you look at the overall shape of the face, it looks kind of like a heart, okay? So volume up here, definition down here. Now, as we age and gravity and time take their course, things start to kind of fall. So all of this entire mass of tissues right here, this tends to fall. So you get the fullness along the bottom part of the face, fullness in the cheeks right here, and a little bit of laxity in the neck. And this is really the point at which most people come in and say, hey, I just don't look the way I used to look, and I want to kind of do something about it. So what happens here? So let me kind of take you through that process so you can kind of see what happens. The first person you're probably going to meet in my practice is my front office, who will set up an appointment, and then we have a consultation. How I like to start off every consultation is with a brief history about your medical history, surgeries you've had, all of the basic medical stuff. Okay, I think that's very important. This is going to help us optimize you for surgery, figure out if you're a good candidate for surgery, if there's any special accommodations that need to be done during surgery. So all of that's got to happen. The second major question I always ask patients is, you have a magic wand, what would you do? So here are the most common things that patients who get 4D facelifts tell me. Number one, I want to look like myself. Number two, I want to look refreshed. I do everything that I used to do. I am active, I go to work, I take care of my family, I do all of these various things, but the person I see in the mirror does not represent how I feel on the inside. And I want those two images to be a little bit closer together. So these are the most common things that I hear. In terms of anatomic stuff, everybody wants the sharp, defined jawline, the sharp, defined neck, and the mid-face volume. Those are the three major anatomic things that I see when discussing 4D facelifts with a patient. The third part of the consultation is where I do my exam. So I take a look at the patient's overall physique. First of all, are they big? Are they petite? What is their skin type? What is their skin coloration? How much solar aging or thinning of the skin do they have? These are all the variables that I'm looking at. How much aging is there? Is there a lot of ptosis or droopiness of the tissues, or is it mild, moderate? And I look at that in three areas: mid-face, jawline, and neck. I have a checklist in the back of my head, and I kind of go through the process and go, okay, what type of lift does this person need? So when I see a patient, I never see a 4D facelift that I go, Mrs. Jones and Mrs. Smith are both getting the same facelift. Every single 4D facelift is different from every other 4D facelift. That facelift is tailored for that patient. So after I've done my examination, I sit down with patients and go, okay, here is my game plan. This is what I would like to do. Before I start with the procedures, I go into this box of anesthesia. So there are two primary categories of anesthesia that we offer for our facial rejuvenation patients. The first box is going to be general anesthesia. So general anesthesia is where you go to an outpatient surgical hospital, you're fully asleep, you don't remember anything, you don't feel anything. You go in, you have surgery, you come home. Simple, easy peasy. Option two is local anesthesia with oral sedation. What does that mean? So in this category, I give patients a lot of medications to give them sedation. That means that their nervousness comes down, anxiety comes down, pain comes down. So they're in this state where they're kind of happy. And then I numb them up in order to do the surgery. Patients that are good candidates for local anesthesia with oral sedation are patients that are healthy, no medical problems, have had surgery before. And when I explain to them what happens during local anesthesia with oral sedation, they go, you know what, I think I can deal with that and that sounds good. So the question is, why do I like this type of anesthesia? First of all, in my hands, I think that patients bruise and swell a lot less with local anesthesia with oral sedation. And the reason is that a lot of the medications that we use for general anesthesia, a side effect of those medications is that the blood vessels can actually dilate or expand. So there's more blood flow and you can get a little bit more oozing, which then translates to bleeding and swelling. Those same characteristics are not seen in local anesthesia with oral sedation. So for that reason, I think patients heal a lot quicker. That's why I really like it, because I think patients can get back to doing their gig ASAP. About 98% of my facial rejuvenation procedures are done with local anesthesia with oral sedation. Now, the second portion of the assessment and plan phase is where I actually explain what I'm going to do. Number 1, facelift. Number 2, neck lift. Number 3, fat transfer. Number 4, a stem cell treatment. So the facelift that we use, I use a combination of 2 to 3 different types of facelifts. I use high SMAS technique, preservation facelift, deep plane facelift. Number 1, I don't want to dissect the skin all the way from here to here. Okay, that's too much skin dissection. So we're going to limit our skin dissection so that there's not as much, the word is called delamination. Second, no facelift is going to work until you target the actual muscle layer. Until you tackle that muscle layer, the facelift isn't going to work. Now, all of these tissues, so all these tissues are actually glued down to the skull at certain contact points. So now, if you remember when I told you that as we age, those tissues fall, yes, those tissues fall, but those ligaments are also holding them to a certain extent. So if you look at it, if I fall and it's tethered here and here, you're going to get a line here. So it is very predictable by knowing the anatomy of these ligaments how people are going to age. Now, if we're going to target that muscle layer and we're actually going to pull the face, you can't pull the face if it's tethered down to the skull, okay? You have to release these ligaments. That is the deep plane facelift right there. You're releasing all of these ligaments so I can take that muscle layer and move it anywhere I want. There's nothing holding me back. I'm not being tethered down. I'm not being prevented from being moved, because I can take big fishing line suture and move your face here. But if those ligaments are pulling down, your face is going to come right back down. Whereas if I actually divide those ligaments, I can put that muscle layer anywhere I want, no tension. The body doesn't like tension. It likes to just exist. So the less tension, the less pulling and yanking, you're going to get a more natural result. It's going to last longer. So component 1, 4D facelift, the face portion. That targets mid-face, jawline. Component 2, neck lift. Everybody wants a nice tight neck, okay? We don't like the flab here, okay? So what do? So in your, just like you have in your face the SMAS, you've got the platysma layer in here. So we're gonna make an incision, find the platysma layer, get underneath the platysma layer, that's the deep neck lift, remove the fat. We're going to shape the digastric muscles. And if the glands are pooching out, we got to take some of that glandular tissue. A lot of scientific stuff, but long story short, you're not going to be able to get a sharp neck if there's a lot of tissue in that area. You're going to have to debulk that tissue to get a sharp 90-degree neck. So that's the second component of the 4D facelift. Now, let's jump way back in time where we talked about the aging. We talked about loss of volume. Every 4D facelift, I like to replenish that volume. What do I like to use? Fat. Your fat. So we either get fat from the abdomen or we can get it from the thigh, different locations. We're going to do a little bit of liposuction. Take that fat, process that fat into different fractionated sizes. And that fat is going to be re-injected into very critical areas. Again, everybody is a little different. Most common areas, this section right here, the tear trough, temple region, very, very common. Along the jawline, another common area. Marionette line, another common area. These are probably some of the most common areas I like to replenish volume. The last component to our 4D facelift, stem cells. So when I'm harvesting your fat, one component within that fat that has been harvested are stem cells. Stem cells are cells that basically have the potential to regenerate tissue. So that volume that was lost at the original portion, we can actually regenerate some of that tissue. So that stem cells are injected or microneedled into the skin to enhance the quality of the skin and enhance the quality of the tissue, enhance collagen, enhance elastin, minimize collagen and elastin breakdown, and turn the balance of tide towards collagen and elastin production, thereby giving smoother skin. So there are your 4 components of your 4D facelift. So typical patients, you come in, local anesthesia with oral sedation, and the surgery portion takes about 3.5 to 4 hours for just a 4D facelift. Most times when I'm doing a 4D facelift, there are other little things that I add along, like maybe upper eyelids, maybe a brow lift, maybe a lip lift. These are some other things that we kind of go through, and we will discuss those during consultation to figure out what is exactly right for you, what is right for the type of aging you have, and what are my recommendations based on the anatomy. For the facelift, I like to use an incision underneath the neck. That incision is roughly about, I'd say, 2.5 centimeters, give or take, so that's about 1 inch. And then there's symmetrical incisions on either side of the face. The incision starts right here, where the ear and the face meet at that point, okay, and goes in a little curvilinear fashion in the sideburn, okay? Then the incision continues between the ear and the face. It goes behind the bumpy thing. This is called a tragus. So I like to go behind it so there's no line in front of the ear, around the lobule, back into this crease, and into the hairline back here. I like to tell my patients that approximately 3 to 4 weeks after surgery that they should be able to wear a ponytail, and most people should not know. So I've done the surgery. What are you going to look like? What are you going to feel like? All of that kind of stuff. Okay. I like to use drains. I think drains are very useful to minimize the amount of fluid accumulation, especially if I do deep neck work. I think it is imperative. I don't think there's another option. Then I put a facelift, that dressing, which looks kind of like a bunch of cotton around the face and fishnet hose around that with this portion open. On post-op day 1, I will take the dressings down. Most of the time, the drains stay in till about post-op day 3 to 4 on average. Stitches start coming out on post-op day 5. Post-op day 7, the balance of the sutures are out on post-op day 7. On average, patients are able to leave the house to do generalized activities like grocery store and the such, probably roughly around post-op day 5, 6-ish. Patients can go out to social events, restaurant, work, post-op day 8-ish with a little bit of cover-up makeup. Patients usually see their final result roughly or about the 2.5 to 3 week point after surgery. And that's the first point where you can really get the wow effect, and it continues to improve after that. So this is kind of a brief synopsis of the 4D facelift. Hopefully that answers a lot of your questions. And if you have any questions, don't hesitate to give us a ring.